years, and I know that you are here first and foremost on behalf of the people you take care of, your patients, because that's why you entered the profession or are going to enter the profession. And your voice today is needed really more than ever to stand up for a couple of really basic principles that we believe in, basic values that we believe in Minnesota. The number one of which is that every person in this state, regardless of where they're from and where they live, regardless of where they work, regardless of their background, ought to get the health care they need when they need it, as soon as they need it, and it's got to be high quality. That's something we can't back away from. Your voice is also needed here today to stand up for another really important principle, especially in these tough economic times, and that is that our health care dollars ought to be spent caring for people and not for administration, and not for building buildings, not for things that don't help people, because our resources are too tight right now to be wasting our money. We ought to have accountability and transparency for where our healthcare dollars ought to be spent, and I know you're here for that. But I also know that in addition to your patients, you are here for your families. You know, in the past several years, our state budget and our economy has been balanced on the backs of middle-class families. We have seen property taxes going up. We have seen tuitions going up. We have seen health insurance premiums going up. We have seen fees going up. It's time to say enough is enough. Everybody in this state, including the wealthiest Minnesotans, ought to participate in responding to the challenges that we're facing with our state budget and our economy, and more importantly, going forward, every single Minnesotan ought to participate in the broad prosperity that has built this country and made it the great country it is. You know, because what's going on in Wisconsin and across this country right now, the question before us in this state, in this country, it's really a fight that has been brought on and truly bought by a privileged few in this country who are capturing more and more of the wealth, and who want to divide us in order to keep holding on to us. That's what the fight is about right now. By being here today, what you are saying is you are not going to let them divide us, right? Are we going to let them divide us? By being here today, what you are showing is that you're unwilling to let their divisiveness break our faith in what really matters in this country. And that is fairness and opportunity for everybody and for a strong middle class. That's what this fight is about, isn't it? And by being here today, you're making sure that the promise of this country, that promise of fairness and opportunity, that you're willing to stand up and fight for it. And you need to send that message over and over and over again, because the stakes are incredibly high right now. This is a historic moment, as Linda Hamilton said. This is the most important fight of this generation. And so thank you for being part of it, for being here today, for standing up for your patients, for standing up for your families, and for standing up for what's right in Minnesota and this country. I really appreciate everything you do. Thank you.